Hello, so this is another article from my college stuff. This one is the relationship between childhood trauma, early life stress, and alcohol and drug use, abuse, and addiction, and integrated in a review. In this review, we discuss the relationship between childhood trauma, early life stress, and substance use, abuse, and addiction. Addiction to drugs is a complex psychiatric disorder that is related to maladaptive and damaging behaviors, with devastating consequences for afflicted individuals, their families, and society at large. On a global scale, 4.9% of the adult population suffers from alcohol use disorder, 22.5% smoke tobacco, 3.5% use cannabis, and 0.3% inject psychoactive drugs. Furthermore, it was estimated that 230 million people around the world have used an illicit drug in 2010. There have been different reports on the prevalence of childhood trauma among patients with alcohol or drug abuse problems. One report reported that over 60% of individuals with drug abuse problems were physically and/or sexually abused during their childhood. Heroin users were found to experience high rates of childhood trauma, such as receiving injuries as a result of physical punishment, penetrative sexual abuse, emotional abuse, and physical neglect. During adulthood, over 25% reported being the victim of unwanted sexual activities, and over 27% reported being an adult victim of violence. As for alcohol, it was reported that 70% of patients with alcohol dependence have experienced at least one form of trauma in their childhood. Another reported in 2006 that exposure to childhood trauma increased the risk of OD, developing alcohol dependency, 7 times more than individuals not exposed to childhood trauma. In addition, another one in 2002 also found that childhood trauma is related to relapse in patients with alcohol use disorder, such that 88% of alcoholic patients relapse, while 64% of alcohol patients without childhood trauma relapse. As far as cocaine, it was found that 34% of individuals with cocaine dependency have experienced physical and/or sexual childhood trauma. Gender differences emerge, with females more likely to experience a range of childhood traumas, which continued after the age of 18 years, in the form of unwanted sexual activity and violence. This review examined the literature regarding the relationship between early stress and childhood trauma, and drug use and addiction, and aims to highlight the importance of assessing interpersonal, early life trauma, and stress factors within clinical settings. This paper will detail animal and human studies that have shown how early life stress and trauma is associated with changes in the stress circulatory of the brain. It will also explore how continuation of addiction and relapse are affected by exposure to stress and its interaction with brain plasticity occurring from addiction. The ways in which these phenomena may contribute to developing and/or maintaining a drug abuse and addiction will be discussed. Studies which evaluated individuals with addictive behaviors have found higher levels of self-reported subsyndromal stress levels compared with controls, which often happen in childhood. These high levels of stress are thought to negatively impact recovery from opioid dependency by increasing cravings and polydrug use. Thus, early life stress can change the structures of the brain, which in turn play an important role in addictive behaviors. The HPA axis regulates the androcorticotropic hormone and cortisol secretion during the stress response. It is vital for cognitive, immune, and behavioral responses to stress. Cortisol is secreted by the HPA axis under both basal and stress-related contexts. HPA axis dysregulation is defined as an important impairment of process that regulates cortisol production through negative feedback. Interestingly, acute and chronic stress affects the HPA axis and other brain components involved in the stress response, and this may increase the reinforcing effects of drugs during initiation, maintenance, withdrawal, and relapse. Addiction has been found to deregulate the HPA axis, leading to inability to adaptively and appropriately respond to stress. Numerous studies have demonstrated that childhood maltreatment and early life stressors are associated with increased vulnerability and the development of psychopathology, including drug and alcohol abuse. In a study of the 181 women in the community sample of intravenous drug using, 60.2 were sexually abused, 55.2 were physically abused, 45.9 were emotionally abused, 83.4 were emotionally neglected, and 59.7 were physically neglected. The findings suggest that the prevalence of all 5 childhood traumas was higher than what has been reported in the general population. Experienced childhood maltreatment has been shown to impact the severity, course, and duration of alcohol dependence. To develop alcohol abuse at an earlier age and experience more severe alcohol abuse than patients with no reported exposure to childhood maltreatment. Furthermore, exposure to intrapersonal violence category events, which would be physical assault, mugging, sexual assault, and kidnapping, was associated with high risk of lifetime use of all drug types. This highlights the importance of clinical intervention screening for a history of sexual assault victims in clients who enter psychological treatment for substance use disorder. Childhood maltreatment has also been linked with substance abuse during early adulthood. Young adult participants with a childhood history of physical abuse have been found to be 48 more times more likely to use illicit drugs in the past year, and 37 more likely to use illicit drugs in the past 30 days, compared to a non-abusing cohort. So, in summary, strong evidence exists that experiencing interpersonal childhood trauma is linked to an increasing vulnerability for substance use disorder. This may be influenced by the permanent changes that early life stressors do to the brain stress circuitry. Evidence also exists that acute and chronic stress affects the HPA axis, and this increases the reinforcement effects of the drug. Stress is also thought to enhance all stages of drug use, from initiation through the dependency and relapse. So that's it for this article. Short, sweet, to the point. But anyway, thanks for watching.